So my name is Kendra Downey, and I'm going to be performing a head-to-toe assessment on Melinda here. Hi, my name is Kendra. I've already performed my hand washing techniques after I entered the room. We already went over her chief complaint, medical history, surgical history, medications, allergies, social history, including alcohol, tobacco, and illicit drugs, last menstrual period. Our vital signs were 123 over 84, heart rate of 74, 98% on room air, respirations 18, and a temperature of 98.2 orally. Alright, so the first thing that I like to do is I just want to go ahead and take a look at your hands. I like to look at the hands. It gives you a good point of hygiene. You can tell if the patient's taking care of themselves. You can look at capillary refill. There's no clubbing, no cyanosis. Let's see, looks pretty good. As we do this, I'm going to, as we do the head to toe assessment, I am going to be looking at the skin the entire time. I'll point out anything that, any sort of abnormalities, but we're looking for lesions, masses, macules, freckles, moles, abscesses, anything like that. Anything out of the ordinary that we think we need to pay attention to. Okay, so first I would like to do is assess cranial nerves 1 through 12. The first thing we're going to do is the olfactory nerve. So, as I would like for you to close your eyes, and I'm going to ask for you to smell something. If you will plug one nostril for me. And what do you smell?
Alcohol.
Perfect. And now if you'll close the other nostril for me. And what do you smell?
Clove.
Perfect. Okay, so we know that the cranial nerve number 1, the olfactory, is intact. We also performed beforehand for the optic nerve, cranial nerve number 2, a visual acuity test using the Snellen chart, and her vision was 20/20 bilaterally. Another test we can do for that is a peripheral vision test. So I'm going to place my fingers back behind your head, and whenever I pull them forward, if you'll let me know whenever they come into your visual field, okay?
Now.
Perfect. Okay, I'm going to do it one more time. We're just going to go a little lower.
No.
All right. So through that, we know that the optic nerve is intact. Next, we're going to assess 3, 4, and 6. Which is our trochlear, abducens, and ocular motor. As we do this, I'm going to have you look at my finger without moving your head, with your eyes only. I'd like for you to just follow my finger, okay? Okay, did you have any blurry vision, any double vision, anything like that?
No.
All right, and there was also no nystagmus, there's no diplopia. So we know that those cranial nerves 3, 4, and 6 are intact. Now we're going to do the trigeminal. And I'm going to press this cotton swab up against your face, either with the soft side or with the sharp side. And if you'll just let me know, okay? So I'm gonna have you close your eyes.
Soft. Hard. Soft. Hard.
Perfect. All right, we're also going to be testing some motor function on this nerve also, but we're going to palpate and feel the jaw. And so here we go. So I'm gonna feel here. And if you'll open your jaw for me. Good. Is there any pain or tenderness?
No.
No, and there were no clicks noted. I'm also going to place my hand up against your face, and if you will just press up against it for me. Perfect. All right, there's 5 out of 5 strength for her neck, and also on motor sensory for that nerve. Next, we're going to do the vestibulocochlear cranial nerve here. So, and first we're going to be doing the whisper test. So I'm going to lean to one side or the other, and I'm going to whisper something. If you could just tell me whatever I said, okay?
36. Pool party.
Perfect. As you do the whisper test, if it was passed just fine, then there wouldn't really be any need to do the Weber or Rhine test, but for this, we're gonna go ahead and do it. All right, so I'm going to place this on top of your head, and if you'll let me know if you will let me know if you can hear it in both ears or if one is louder than the other, okay?
Okay. Here you go.
Perfect. Okay, and then I'm going to do that again, and I'm just going to place it behind your ear. If you'll let me know whenever you no longer hear it, and then in front of your ear, and let me know the same, okay?
Sorry, it's slow no.
It's okay.
Yeah.
Perfect. All right, so that lets us know that the air conduction is greater than bone conduction, which is normal in this case. We're only going to do the one ear just to help save time. All right, so 8. Now we're going to do 9, 10, and 12, which is the hypoglossal, the vagus, and the glossopharyngeal nerve. Get this little thing here. All right, so I'm gonna look in the back of your throat, and if you'll just say "ah" for me, okay? All right, cough for me. Say "ka."
Ha.
All right, and then I'm sorry, gonna make you. All right, so sorry about that. So for those, to make sure that those are all intact, we're looking to make sure that the palate is symmetrical with rise and fall. The uvula is midline, and then also her gag reflex. I'm gonna go ahead and ask you one more time if you'll stick your tongue out, and then just, we're gonna move it up, down, and then to the side. So move it up, down, and to the side. And again, we're just looking for some for symmetry there. All right, and the last nerve is the accessory nerve. So I'm gonna place my hands on your shoulders, and if you'll try to push them. Perfect, and again, 5 out of 5 strength and is equal bilaterally. Okay, so now that we finished the cranial nerves, I am gonna do a fundoscopic exam. And I'm gonna dim the lights, and we'll also look at pupillary response. Okay, so I'm gonna shine this bright light into your eyes for a couple moments if you'll just look straight ahead for me. So we're testing direct and consensual, direct and consensual. And now, just gonna look into the back of your eye here. Alright, so we do see the red, and disc margins are sharp, pink and orange, and blood vessels noted, with no abnormalities seen at this time. Sorry for the light. I'm going to turn that back on. Okay. So now we're just going to start from the head and go down. So I'm going to inspect and palpate your head. We're looking for the texture of your hair, any bumps, lesions, masses, pain or tenderness. Any pain?
No.
Anywhere? Okay. Her head is normal cephalic. There was no abnormalities that were palpated. From here, we're going to palpate the maxillary and frontal sinuses. All right. Any pain or tenderness?
No.
Awesome. Okay, and next we're going to move down to the ear. Again, we're only going to be doing one ear at this time, just to help save on time. So first, we're going to look at the auricle of the ear, And we're going to palpate for any masses or lesions. There are none at this time. We're going to look at the external canal. We're going to look for any redness, any debris, any Crimean impaction, tenderness, which that looks good here. And then we're going to pull back on the auricle. All right. And our tympanic membrane, there was no bulging, no fullness. It was a pearly gray color with the cone of light at 5 o'clock. All right. So from the ear, we're going to look into your nose. There we go. Getting low in there, I'm so sorry. All right, so from there, the septum is midline. There is no polyps, no redness. It was a moist pinkish color. And then we will go to the mouth one more time. Open wide for me. Good. So there's no lesions, no masses, no white spots, nothing like that. It is noticeable she does have some cavities that were filled. Other than that, good dentition. Nothing looks loose or anything. I don't know if you felt any loose teeth. I can feel in your mouth.
No.
All right, so from the mouth, we're going to palpate the lymph nodes. So we're going to start from the pre-auricle, posterior auricle, occipital, tonsillar, submandibular, submental, to superficial cervical, deep cervical, posterior cervical, down to supraclavicular, and to axillary. Did you have any pain or tenderness?
No.
All right, and there was no palpable lumps, masses, or anything like that. Looking at the neck, I don't see any goiters, again, lumps or masses. I'm going to palpate the thyroid posteriorly. Alright, so if you'll just swallow for me. Perfect, and I'm going to deviate it to the right. You'll swallow one more time. And to the left, one more time. Alright, so the trachea is midline, and again, thyroid is palpable with no masses, no goiter, no lesions. And then I am going to I'm going to palpate first the carotid artery on both sides, and then we'll just go down the pulses from there. Alright, and I'm going to listen for any bruits. The pulses were equal and strong bilaterally, +2. Alright, and if you'll take a big deep breath for me and hold it. Okay, let it out. And then take another big deep breath for me and hold it. Alright, and no bruits were auscultated. And I'm going to palpate our brachial arteries. And they are strong and equal. Our radial arteries. Are strong and equal. Our popliteal arteries. Are strong and equal. Our posterior tibial. That are strong and equal, and our dorsalis pedis. that are strong and equal also, plus 2 pulses equal bilaterally. Okay, from here, I'm going to ask if you'll turn around and I'm going to inspect, percuss, and auscultate our posterior chest wall or your back. Okay, from here we can see that we do have multiple just little freckles or moles. None of them have an irregular border. There's no multiple colors in them. They're all flush to the skin. Has there been anything that you've been worried about with any of these markings?
No.
Have you had them for quite some time?
Yes.
Okay. And then we can also note that there is a scar here on her back. That was from part of her surgical history when she was 11. She did have Harrington rods placed at that time. All right. So we looked at the back as a whole. Now I'm going to listen to her lung sounds. All right. If you'll take a big deep breath for me. Let it out. And in and out. All right, so there are no adventitious breath sounds, no wheezing, no crackles, no rhonchi. I'm going to palpate the tactile fremitus at this time. So I'm place my hands equal width apart from her spine, fingers spread apart. And if you will repeat 99 for me.
99.
Again.
99.
And again.
99.
All right. So that was, what we were looking for on that is if any sort of the lung filled fluid, or any sort of air that we can be able to just feel from that side. For now, I'm going to palpate the costovertebral angle. What this does is, plays a lot if you have urinary tract infections, possibly kidney infections, just to see if there's any tenderness to that area, okay? Any pain or tenderness?
No.
Good. All right, and now we're going to percuss the diaphragmatic excursion. And then I'm just going to start and percuss up here and all the way down. All right, so the all lung fields were resonant, and now we're going to do the diaphragmatic excursion. So I'm gonna have you take a big deep breath and hold it in for me. All right, you can let that out. Okay, and then this time if you'll take a big deep breath in for me and then let it out and hold your breath in. Perfect. Okay, and you can breathe regularly now. So our diaphragmatic excursion measures 3.5 centimeters. Oh, no. Yeah, about 3.5 centimeters, which is normal. Okay, so at this point in time, I'm going to have you turn back around towards me. And we're going to inspect and auscultate the chest wall with lung sounds and heart tones. Pull this down here. Again, we're inspecting the skin all over for lumps, masses, lesions, anything that would be abnormal. Again, there's not really anything that concerns me. We see some freckling, just, little freckles, maybe a mole, but again, all of them. Borders are normal, nothing irregular. There's no irregularity in color. Alright, so first I'm just gonna listen to your breath sounds. Take a big deep breath for me. Come up under here. On this side. Alright, and again at this time, no adventitious breath sounds, equal and clear in all lung fields. Now we're going to listen to some heart tones. So we're going to listen to the aortic, your pulmonic, Erb's point, our tricuspid, and then mitral valves, okay? So first we're going to listen to the diaphragm. With the diaphragm. At second intercostal space, mid-clavicular line on the right side. Or close to the sternal border, sorry. Then the second intercostal space, left sternal border. Third intercostal space. Sorry, and as we do this, I'm going to have you go ahead and lean forward just a bit like that. I'm sorry. I'm going to start over there. And then now I'm just going to listen to the bell, with the bell. And again, if you will lean. Perfect, thank you so much. Perfect, so there were no clicks, no gallops, and S1 and S2 were heard clearly. Now I'm going to palpate at the point of maximum impulse, which is about 5th intercostal space, mid-clavicular line, okay? So I'm gonna come up here just right underneath this breast, and we're just gonna perfect, and her point of maximum impulse is tapping and brisk. Okay, so I'm gonna have you put your gown back up, and then I'll have you lay down, and I will measure jugular venous pressure. Okay, so I'm gonna raise the head of the bed up approximately 30 degrees. I will have you tilt your head to the left, and we're going to be looking at the highest point of pulsation from her jugular vein. And then we're going to measure that from there. Actually, go this way, horizontally, to the sternal angle. Which is about 5 centimeters, which is normal. All right, from here, I'm going to lay the head of the bed down, and I'm going to inspect, percuss, and palpate your abdomen, okay? So lift your gown up. I'm gonna pull these down just a little bit. All right, and as we're looking at the abdomen, we do see that there is some hypo and hyperpigmented striae. which is completely normal. There again, we do see that little bit of moles. They're all flesh with the skin, circular border, no discoloration. So we've looked at the abdomen. Now I'm going to go ahead and listen to all four quadrants of bowel. All vowel sounds are normoactive and they were heard in all four quadrants. At this time, I'm going to palpate for the aorta and listen for any bruits. There are no bruits auscultated. I'm also going to listen from the renal arteries again for any bruits. And no bruits were auscultated at this time. There's also no visible pulsations or anything palpable. That should not be palpable. I'm going to start with some light palpation. I'm going to percuss the abdomen first. Let's do that. So there's tympany heard in all four quadrants. And then let's go ahead and measure your liver here. So let's do bowel. And our liver is measuring approximately 6 centimeters, which is normal also. All right, so now I'm gonna do some light palpation. One more time. We're gonna palpate over here, or percuss over here for the spleen. Now we will do some light palpation and then some deep palpation. So some light palpation. Any pain or tenderness?
No.
Okay. And then we're gonna go a little deeper. Any pain or tenderness?
No.
Okay. And we're gonna palpate the liver. Perfect. There's no rigidity, no nodules or anything felt. We'll try to palpate the spleen. The spleen is non-palpable, and we'll try to palpate the kidneys. So I'm going to place one hand on your back, and then there's going to be some deep palpation from the anterior side of your stomach, okay?
Okay.
The kidney is not palpable on the right side. kidney is also not palpable on the left side. All right. So from here, I'm going to start my musculoskeletal assessment. I'm just going to have you raise this leg up here and bend at the knee, and we're going to go externally at the hip and then internally at the hip. Notice there is slight decrease in range of motion with the internal rotation. And then just bend at the knee here. We'll just go down the foot. And then also, if you'll just rotate the ankle. Perfect. Full range of motion in knee and the ankle. Come over here to the left side. We'll bend this one up. And then we'll do some external rotation and then internal rotation. And this, the left leg definitely does have a little bit more internal range of motion than the right leg does. We'll bend here at the knee. Perfect. And again at the ankle. All right. Full range of motion there. We'll get to do our, if you'll push up against my hands. Perfect. Push down. Our dorsiflexion and plantar flexion. On the lower extremities, there was 5 out of 5 strength that were equal and strong bilaterally. Okay. All right. I'm gonna have you sit up for me now. Perfect. Okay, and we're gonna start at, let's start with our shoulders. So we're gonna have you hold your arms out and then yeah, okay, perfect. And then if you'll put your arms behind your head and try to touch your hands. Okay, and then now in the other direction. And from there I can see that the right shoulder does have slightly less range of motion than the left shoulder. Left shoulder has full range of motion. From your elbows, just bend. Okay, and then if you'll try to pull towards you and try to push towards me, great. Let's there we go with the wrists, perfect. And then if you'll hold your arms like this, we're gonna test cerebellar function here, and if you'll just kind of flap them over, perfect, very fast. All right, so now what we're going to do is I'm going to have you touch your finger to your nose to my finger, and I'm going to move it in a couple different quadrants. Again, this is testing cerebellar function. All right, so if you'll, there we go, finger there. All right, and then if you'll take this left heel and rub it on your right shin. Nice, and if you'll do it with the other leg. Perfect, okay. If you'll hold your hands out, I'm going to test for a little bit of proprioception here in the middle of things. And if you'll close your eyes and tell me if your finger goes up or down.
Okay. Down.
Up. And I'm going to go to the toes.
Down. Down.
Okay. All right. Last couple of tests. I'm going to have you stand up for me. We're going to do the Romberg test. And I'll just have you stand with your arms out. Any dizziness, sway, anything like that? Okay. I'm going to have you walk from heel to toe, from here to over there for me. Got a good gait. Whenever you walk back, if you will walk on your tippy toes. Perfect. And then one more time if you'll walk on your heels. All right, and then last test, if you'll just stand right here in front of me and then just squat down. Squat down and back up. Perfect, thank you so much. All right, so there were a couple of tests that were deferred this morning, and that would be, one is a breast exam. You do want to raise the importance of self breast exam every month. You would have to hold your arm up above your head and palpate in a circular motion all around the breast to make sure that, again, no masses, no lumps, no different textures of the skin and of the nipple, no discharge, no turning inward of the nipple. Also a pelvic exam. For pelvic exams at your primary care office, you would be looking at the external genitalia, then the internal genitalia with a speculum. You can looking for redness, tenderness, swelling, purulent drainage, odors, and then they could also send off for any sort of specimen collection that they needed to, and even for a pap smear, which again is just swabbing that part of your cervix, the outer and then inner parts. Then a rectal exam was deferred today. You would just look at the outer anatomy, looking for any hemorrhoids, redness, swelling, tears, and then you would palpate inside the rectum with lubricated fingers, again looking for feeling for hemorrhoids, tears, stool, anything like that at that time, tenderness, edema, and then fissures. And then also a prostate exam was deferred at this time. Again, for your male patients. But the prostate exam, you would have the gentleman bend over. You would insert a finger into his rectum at 6 o'clock, and then you would turn it all the way up to 12 o'clock, feeling on the inside, go all the way back down and all the way on the other side, and then also palpate the prostate at that time. This concludes our head to toe assessment. I'd like to thank Melinda very much for taking this time with me, and hope you have a great day.